This is a rehabilitation regime to treat patients who have acute pain and swelling in their knee. This can be a result of an injury, but can also be due to degeneration or arthritic conditions of the knee. This video should be used in conjunction with the more detailed programme that can be found at www.thejointrecoveryclinic.co.uk. This video takes you through phase 1 of the regime, which concentrates on reducing the swelling using the RICE principles and encourages gentle exercises to allow your knee to recover movement and gets the important quadriceps muscle in the thigh contracting. RICE stands for rest, ice, compression and elevate. Rest. This does not mean taking to bed. Excessive exercise or activity will make your knee swell. You should therefore restrict your day-to-day activities as much as possible and avoid sports activities. In more severe injuries, your doctor may prescribe a brace or crutches. Ice. You do not necessarily have to buy expensive cold compression packs. We find a bag of frozen peas wrapped in a tea towel is very effective. Take a bag of frozen peas from the freezer and break up the peas in the bag. Wrap it in a towel so the ice is not in direct contact with the skin. Put one bag behind and one on top of the knee. Do this for 15 minutes, 3 to 4 times each day. Take care to look at the skin where you've iced to be sure there isn't any damage to the skin. Stop using ice immediately if there is any sign of skin damage. Compression. You can use an appropriately sized compression bandage to the knee, which is very effective in reducing swelling. If the bandage is too tight, it may cause swelling in your ankle. Always take the bandage off when you go to bed at night. Elevation. When you're elevating your leg, we suggest using a pillow under your ankle. Avoid putting the pillow behind your knee because it will stop the knee going straight. If there is nothing behind the knee, it will help the knee straighten. You should try and elevate the leg for as much of the day as you can. The general exercises will restore the range of motion to the knee and start to help the important quadriceps muscle in the knee recover. There are 3 exercises to perform and you should try and do them approximately every 2 hours during waking hours. These are flexion extension movements, the static quads exercises and the straight leg raising. Firstly, the flexion extension movement is an exercise to encourage full movement of the knee. Lie on your back, straighten your knee out fully. You should try and straighten it out as far as your other knee will straighten. Now bend your hip and knee by bending your foot to your bottom. Now straighten your knee out again until the leg is straight. Repeat this 10 times. You can compare the normal range of bend with the other leg. The next exercise, the static quads, will encourage the quadriceps muscle to contract. Lie on your back and put your legs together. Move your ankle back so your toes are pointing to the ceiling. Now push the back of your knee into the floor or bed. You should feel the quadriceps muscle contract. Count to 5, then relax. Repeat 10 times. You should only progress to the third exercise, the straight leg raise, once you feel you can perform exercise 2, the static quads exercise, with ease. Lie on your back, put your legs together. Move your ankle back so that your toes are pointing to the ceiling. Now push the back of your leg into the floor. You should feel your quadriceps muscle contract. Now lift your heel about 30 centimeters or 12 inches off the floor with your toes still pointing to the ceiling. If you can, hold this position for a count of 5, then lower your leg back to the floor. If you're able, perform this exercise 10 times. At first, it's unlikely you'll manage this as many as 10 sets, but you can build up to this. Once you've completed phase 1, you can progress to phase 2. To be ready for phase 2, your knee swelling should have considerably reduced. You should have almost full range of movement of the knee and should be able to straight leg raise. For more details on this programme, subsequent phases and other programmes, please visit www.thejointrecoveryclinic.co.uk.